Hello, everybody. My name is Amarachi, and this week article discussion is going to be on the effects of reinforcement without extension on increasing compliance with nail cutting, a systematic replication. I've included the authors. The rationale of this study is that it evaluates the resistance of individuals with autism and other developmental conditions in participating in personal hygiene routines, especially with caregivers. And some of them can be dental flossing, nail cutting, um, even toileting, dressing. The aim of the study was to evaluate the use of differential reinforcement without escape extension on escape responding with compliance in nail cutting. So I'm going to briefly talk about the previous studies. One of the studies was to evaluate stimulus feeding and positive reinforcement without escape extension to increase compliance with blood draws. So the participant had a needle phobia and resisted blood draws that prevented his caregivers from monitoring his blood glucose level for over 2 years. Stimulus feeding and differential reinforcement of other behaviors using preferred edibles were used to increase compliance by progressively reducing the distance between the lancet and the participant's index finger. So, results shows that the intervention, increased the participants' tolerance with blood drawing for up to 2 months. So, the next study um, evaluated effects the effect of stimulus feeding without the use of escape extension to increase toothbrushing compliance of 3 children with autism. The intervention that was used is a 30-step stimulus feeding procedure that first gradually decreased the distance between the participants and the toothbrush, and secondly, gradually increased the duration that the participants tolerated toothbrushing. Again, preferred edibles were used to reinforce compliance with the current steps of stimulus feeding procedure. The results showed that the intervention increased each participant's tolerance for toothbrushing for up to 60 seconds and was also generalized across caregivers. The third previous study was to increase haircut compliance by providing a preferred edible item contingent on compliance with sitting during haircuts for progressively increasing durations of time. The experimenters programmed a concurrent schedule of reinforcement in which compliance produced edibles and escape responses produced breaks. The intervention immediately reduced the participants' escape response to zero level and increased the compliance during haircut. So by the end of the study, the participants sat for up to 160 seconds. So based on these 3 studies, in the current study, the participants were 2 adolescent boys who lived in a residential treatment facility. The first one, Jackson, was 16 years old and had been diagnosed with autism together with other conditions such as ADHD, ID-Josh syndrome, Marfan syndrome, as well as significant disability. The second participant, Stephen, was 12 years old, diagnosed with autism also, epilepsy, diabetes, ADHD, and other intellectual disability. Although Jackson was compliant with most of the instructions, attempts to cut his toenails um, were unsuccessful, knowing his escape behaviors during the attempt. So with Jackson, he was good with listener responding, but then he had problems with having his toenails cut. And Steven, on the other hand, demonstrated escape behaviors with attempts to pull away his hand and foot from the caregiver every time during the routine. But one thing about the caregiver reported about Steven that he was good with two-step directions. If you tell him to sit down, he's gonna sit down. But then when he had to come to nail cutting, he was resistant. During the study, frequency data on escape responses was collected, assessing both participants and then used to calculate the IOA. That's the inter-observer agreement where two observers, record the same score. The method used, frequency data was used to collect escape responses and nails cut of the participants. So for every nail cut allowed by the participant without any escape responses was called. So toenail cutting focus was on Jackson and fingernail cutting was on Steven. Materials used included nail clippers, sanitizing wipes, and preferred edible items. The preferred edible item for Jackson was the Reese's peanut butter cups, and for Steven was Whoopers. The design procedures The design and procedures employed require the use of reversal design to establish the impact of using reinforcement without extension and at the same time assess compliance with nail cutting and corresponding escape responses. The baseline sessions ended 5 minutes after all the participants' nails were cut. The other sessions were held after 2 weeks to allow for sufficient nail growth. So in essence, there were 3 assessments: pre-experimental assessment, the baseline assessment, and the treatment. The treatment and baseline assessment were similar, only that the therapist would inform the participant that for each nail cut, the participant will be rewarded a snack. So for the pre-experimental, this was an assessment done to find out which preferred edible each participant like, and that was going to be used during the treatment. And for the baseline, there was no edible use, but it was instead used during the treatment. In this regard, the preferred edible items remain available throughout the session. So results and discussion. So for this is Jackson's results and this is for Steven. So again, with Jackson, where the focus was on toenails. So like at the beginning of the assessment, there was during the baseline, that's why the edible wasn't used. There was 0 score on toenail cut, but then during the treatment with the preferred edible delivered, there was an increase in his acceptance to cut his nail and a decrease in escape response. And again, after 2 weeks, without the preferred edibles, 0%. I mean 0% nail cut, and then it increased once the therapist delivered the preferred edible for every nail cut. So similar to Stevens, there was an increase when the edibles was delivered, and a decrease in escape. The results of the study indicated that the use of extension in treatment was most likely expected to result in negative outcomes such as problem behavior. It is evident that the use of positive reinforcement offered in the form of a preferred snack was expected to result in increased compliance of the participant in various activities such as the reduction of escape responses when trimming the nails. The finding in the research depict replication of earlier study that informs the use of escape extension by targeting the personal hygiene routines, which in this case was nail cutting. So we see like similarities in like the results of the previous studies which I talked about, and the present study. In this regard, the two participants recorded low rates of escape behavior during nail cutting, which is an indication that using preferred snacks serve as an abolishing technique for the escape behavior. So, following the study, there is need to conduct further study to establish whether positive reinforcement could be used to increase compliance in other personal hygiene routines, and also across caregivers. So my question is it possible that the participants' preferred items function as an abolishing operation for escape responding by decreasing aversiveness of nail cutting process? And my second question is, what are your overall thoughts in the use of reinforcement without extension treatment to participants in compliance of hygiene routines? Thank you. Hope you enjoy my presentation, and I'm looking forward to your responses.